Hi, my name is Anthony Nichols, and I'm one of the head and neck surgical oncologists. I'm also chief of the Division of Head and Neck Surgical Oncology and director of the Translational Head and Neck Cancer Research Lab. Our program of head and neck surgical oncology is a very busy practice that involves 5 different head and neck surgeons, but we also interact with a large group of radiation oncologists and medical oncologists, as well as researchers at the London Regional Cancer Program. Taken together, we treat over 500 patients per year with serious head and neck cancers, and we also run a very multifaceted research program. I was very proud to join this program in 2009, and the Department of Otolaryngology Head and Neck Surgery at Western University already had an absolutely outstanding clinical and research reputation, not just locally, but internationally. And I think that's only grown over the 10 years that I've been here. What we look for in residents coming into our program are several things. So first and foremost, they have to be smart, bright people that sincerely care for patients that are very hardworking. Additional attributes are people that are particularly academically minded and are willing to contribute to our academic mission of education as well as research. That we want to create the very best otolaryngologists, head and neck surgeons that we possibly can to care for our community, as well as to be future leaders both in the community as well as academically. I really describe our program as a family where we have lots of get-togethers, whether it's journal clubs, or other events at people's homes. And I think it really creates this family atmosphere that makes everyone comfortable in a very nurturing learning environment. You know, you hear these horror stories of some departments elsewhere where there's a lot of animosity. I'm really proud to say that we're truly collegial. Within the 5 head and neck cancer surgeons, we work very closely. We share patients, we do surgeries together, and we also collaborate closely for teaching initiatives as well as research. I'm very proud to have mentored numerous residents throughout my 10 years here, several of which have become surgeon scientists like myself. I think I speak for all of our faculty that we really enjoy working with residents and working with these bright, hardworking young people. They've created some incredible research projects and come up with a lot of ideas on their own. Together with the other head and neck surgeons, radiation oncologists, and medical oncologists, we built a very multidisciplinary, multifaceted head and neck cancer research program. And it spans from clinical trials. Indeed, we've recently completed some world's first trials that have changed clinical care worldwide. It's also focused on translational research to how to identify which patients are going to do well with therapy and which are going to do poor. But my colleague, Dr. McNeil, does population-based outcome research as well as leads our survivorship program. We also have a new surgeon scientist recruit, Dr. Adrian Mendez, who focuses on quality of life scores as well as facial nerve rehabilitation. Moreover, our chair, Dr. Kevin Fung, is a world expert in education in otolaryngology and has led numerous initiatives. And the dean of our department, but also a faculty member, Dr. John Yu, has really done some pioneering surgical innovation that's changed some paradigms worldwide. Essentially all of our residents match to absolutely top-tier fellowships. I think that our residents match as well as any program in the United States, not just in Canada, in fact. Going to Ivy League programs, we've had graduates go to Stanford, Harvard, and other such named institutions and had incredible experiences. So I've lived in London since 2009, and in full disclosure, I was a bit of a big city snob, right? So I grew up in Toronto, and then I did all my training in Boston. And so London is a little bit quieter, but I've really learned to appreciate so many things about London, including the great quality of life, the absence of bad traffic. There's lots of green space and areas to explore and hike and explore nature. And there are lots of great restaurants and art. You may have to look a tiny bit harder than Boston or Toronto to find it, but it's there. And so I really enjoy living here. This is a tremendous place to raise a family. As I said, the cost of living is low, to be very honest, and there's lots of accessibility to activities for kids, green space for kids, daycare, and lots of wonderful places for them to get educated. So that's certainly a strength of the city. In terms of owning a home, it's just night and day versus a big city. So when I trained in Boston and when I was a medical student in Toronto, it'd be pretty rare for a resident to own a home in either of those places, whereas here I'd say it's very routine. And for our residents, that's been able to be a good investment for many of our residents and a great way to start your financial education as well as your medical education. Everyone's work-life balance is a personal choice here. I think that everyone sets their motivations. There's essential things that you can do. So as a resident, there's taking care of patients and studying for your exams, but there's lots of optional things like being a leader in terms of taking the extra mile to educate other residents and medical students to do research projects. And I think there's certainly a range of people there. But I'd like to think of myself as a very hardcore researcher, and despite working on some evenings and weekends, I like to think I still have a great quality of life and still get to exercise, travel, spend a lot of time with family and friends. And so hopefully the residents see that in something that they can mirror in their own life. But I would say that the majority of my colleagues, I think, have excellent work-life balances in that way. So I was an athlete. Now I'm mainly at the gym and I ride my bike. And so those are things I love to do. But I'm very active, like 5 or 6 days a week. And I'd say that many of our department members are very avid sports or exercise fanatics in one way or another. It's very common. Through the medical school, there's actually a program called Transition to Residency, where upper year residents as well as faculty actually give courses on how to make that transition. And it is a significant transition from being a medical student to residents. It's a lot less of the books and a lot more of time in the hospital taking care of patients with a lot more responsibility. And the feedback on that transition to residency program has been very favorable. Coming here, I already knew that this department at Western University had an outstanding clinical and research reputation. And from my interviews and discussion with the other faculty members, I knew it was going to be a collegial place. But over my 10 years, those faculty members have become good friends, and many of the residents have become good friends, and I even say part of the family. And what I've seen from the program itself is that it's grown. So we've grown in number, the scope of what we do, the volume of surgery that we do. We're teaching more, we're doing more educational innovation. We're also doing markedly more research, and research that's even more impactful than what's being done. And so I'm pleasantly surprised, and it really makes me feel like we are the best otolaryngology head and neck surgery program in the country.